The fluorescent hum of the emergency room was a constant, indifferent predator. It stalked the long, sterile hallways of St. Jude's Metropolitan, a sound that Clara had come to associate with a specific kind of exhaustion, the kind that settled deep in the bones. For 3 decades, she'd been a nurse. Now, in her late 50s, with threads of silver woven through her tightly pinned hair and a network of fine lines around her eyes, she felt invisible. An old piece of furniture that the hospital hadn't gotten around to replacing. Tonight, the usual chaos reigned. A 3-car pileup on the interstate had flooded the bays with the moans of the wounded and the sharp metallic tang of blood. Clara moved with a quiet efficiency that was often mistaken for slowness. Her hands, which sometimes carried a faint, frustrating tremor, were steady as she prepped an IV line. Her limp, a souvenir from a fall down icy steps years ago, or so she told people, was more pronounced when she was tired. Tonight, she was very tired. "Nurse!" The voice cut through the din like shattering glass. Dr. Preston Hayes, head of emergency medicine, stood over Trauma Bay 2, his tailored Navy scrubs immaculate, his expression a familiar mask of contempt. He had the kind of polished Ivy League arrogance that made interns tremble and senior nurses grit their teeth. "Clara, are you napping over there? I asked for a 16 gauge for this central line 5 minutes ago. Is that too complex an instruction?" Clara held up the catheter she'd selected. "Doctor, with the patient's history of collapsed veins, I thought a 20-gauge ultrasound-guided peripheral IV would be faster and less traumatic. We could push fluids just as..." Hayes snatched the package from her hand and threw it onto the counter with a clatter. Several junior residents, including his favorite sycophant Jessica, turned to watch the spectacle. "I don't pay you to think, Clara," he sneered, his voice loud enough for the entire ER to hear. "I pay you to follow the orders of a physician who has a decade more education than you will ever acquire. You are a glorified maid with a nursing degree. Now, get me the 16 gauge I asked for. Know your place." The words hung in the air, thick and suffocating. Jessica offered a small, cruel smirk. Clara's face remained impassive, a blank wall she had perfected over years of enduring such humiliations. The tremor returned to her fingers, a subtle vibration she hid by clenching her fist. She simply nodded, her voice a near whisper. "Yes, doctor." She turned and walked toward the supply closet, her limp feeling heavier than ever. Each step was a quiet protest against the burning shame in her gut. She could feel their eyes on her back, the pity from some, the scorn from others. Inside the closet, she leaned her forehead against the cool metal shelf, taking a single shaky breath. The scent of antiseptic and sterile gauze was suffocating. She saw not the neatly organized boxes of supplies, but a dust-choked tent in Kandahar, the air thick with the smell of sand and iron. "Control your breathing, Angel 6. Control the situation." The thought was an echo from another lifetime. She grabbed the 16-gauge catheter and walked back out, her face once again a placid mask. The night wore on. The pileup victims were stabilized or sent to surgery. A fragile peace began to settle over the ER, punctuated only by the rhythmic beeping of monitors. Hayes, holding court at the nurses' station, was recounting a story about his latest yachting trip, his voice booming with self-importance. Clara was quietly restocking a crash cart, her movements precise, almost ritualistic. Every item had its place. Every vial, every ampule, every roll of tape was aligned with military precision. "Look at her," Jessica whispered to another resident, loud enough for Clara to overhear. "It's like she has OCD. She spends more time organizing that cart than she does with patients." Hayes chuckled. "It's what happens when you've been doing the same menial job for 40 years. The brain fixates on trivial things. Let the old girl have her little hobby." Clara's jaw tightened, but she said nothing. She continued her work, her focus absolute. She wasn't just stocking a cart. She was prepping a go bag. Muscle memory from 1,000 frantic moments under fire, where knowing exactly where the decompression needle was could mean the difference between a brother coming home or being tagged for a flag-draped transport. They saw obsession. She was simply maintaining readiness. Suddenly, a new sound sliced through the night. It wasn't the familiar whine of a city ambulance or the high-pitched siren of a medevac helicopter. This was a deep concussive whump, whump, whump that vibrated through the very walls of the hospital. It was the sound of heavy rotors beating the air into submission. Heads turned. Nurses and doctors moved to the windows, peering out into the stormy night. Descending towards the hospital's helipad was a matte black helicopter, sleek and predatory with no markings save for a small, subdued American flag on its tail. It was a MH-60 Black Hawk, a bird of war, utterly out of place in the civilian sky. The ER doors burst open before the rotors had even spooled down. Two men in tactical gear, rifles held at a low ready, swept the room with cold, professional eyes. They were followed by a team of paramedics in flight suits, flanking a gurney that moved with frantic speed. On it, a man, a mountain of a man, was thrashing against his restraints, a guttural roar of pure agony tearing from his throat. He was covered in blood and grime. A makeshift tourniquet was cinched high on his thigh, but blood still pulsed from a ragged wound in his leg. His arm was bent at an unnatural angle, and a dark, spreading stain on his chest spoke of a catastrophic injury. Dr. Hayes, his yachting story forgotten, puffed out his chest and strode forward. "I'm Dr. Hayes, chief of this ER. What do we have?" One of the flight medics, his face grim, rattled off a report. "John Doe, multiple GSWs, blast trauma, suspected tension, pneumothorax. Vitals are all over the place. We've pushed 2 units of ONEG and a gram of TXA, but we can't get control. He's fighting everything we do." The patient was a force of nature. He snapped a thick leather restraint with a single violent jerk. His eyes were wild, unfocused, blazing with a mixture of pain and combat-honed adrenaline that no civilian doctor could comprehend. "We need to sedate him now," Hayes yelled, his voice a pitch higher than usual. "Jessica, 50 of ketamine and 10 of Versed, push it." Jessica fumbled with the vials, her hands shaking. As she approached with the syringe, the wounded soldier's arm lashed out, sending the syringe flying across the room where it shattered against a wall. He roared again, a sound of primal fury. "Hold him down!" Hayes shrieked, his composure shattering. 2 large orderlies tried to pin the man's shoulders, but he threw them off as if they were children. The situation was devolving into chaos. The monitors screamed alarms as his heart rate spiked into a dangerous rhythm. He was going to kill himself on their table. Through it all, Clara had been standing near the wall, a silent observer. But she wasn't watching with fear. She was assessing. Her eyes, so often downcast and tired, were now sharp, missing nothing. She saw the tracheal deviation, the distended neck veins, the asymmetrical chest rise. She saw the specific pallor of his skin, the cyanosis creeping into his lips. She saw a man not just in pain, but drowning on dry land. While Hayes screamed for more drugs and more manpower, Clara began to move. The hesitant limp was gone. She moved with a purpose that was terrifying in its intensity, her steps economical and swift. She didn't walk, she glided, a predator in her own right. She snatched a 14-gauge angiocath from the cart she had so meticulously organized. "What the hell do you think you're doing?" Hayes bellowed, turning on her. "Get away from him! You're a liability! Security!" Clara didn't even look at him. Her gaze was locked on the dying soldier. Her voice, when it came, was unrecognizable. It wasn't the timid whisper of Nurse Clara. It was a command voice, forged in the crucible of combat, sharp and clear and absolute. "Everybody back off, now." The sheer authority in her tone froze everyone, even Hayes. She reached the side of the gurney. The soldier, sensing a new presence, swung a fist wildly. Clara swayed back, dodging the blow with a dancer's grace, a movement that should have been impossible for a woman with a limp. She leaned in close, her mouth just inches from his ear, her body shielded from his thrashing. The ER held its breath. They expected her to be thrown across the room. Instead, she spoke. Her words were low, calm, and clear, meant only for him, but in the sudden silence, everyone heard them. "Easy, Trident, easy now." The soldier continued to struggle, his breathing a ragged, wet gasp. She spoke again, her voice a perfect blend of command and comfort. "The fight's over. You're home. Angel 6 is here. I have you." The effect was instantaneous and profound. The soldier froze. His entire body went rigid. The animalistic rage in his eyes vanished, replaced by a flicker of dazed, shocked recognition. His head turned slowly on the pillow until his wild eyes locked with hers. He stared at her, at the graying hair and the tired face, and saw something else entirely. He saw a ghost, from a sun-blasted hellhole half a world away. His breathing hitched. A single tear traced a path through the grime on his cheek. He stopped fighting. He went completely, utterly still. He just stared at her, his trust absolute. A collective gasp went through the room. Dr. Hayes looked as if he'd been struck by lightning. The two tactical operators by the door exchanged a look of pure disbelief. Clara straightened up, her focus shifting from the soldier to the wound. His lung has collapsed. He's in cardiac tamponade from the pressure. Stop compressions, she ordered, though no one had even started them. It was a diagnostic command. He needs a needle decompression, now. She didn't wait for permission. She ripped open the soldier's torn shirt, palpated his chest with an expert's touch, finding the second intercostal space in the mid-clavicular line in a fraction of a second. Clara, you can't do that. That's practicing medicine. I will have your license. Hayes finally found his voice, sputtering with impotent rage. Clara didn't spare him a glance. She uncapped the needle, her hand utterly rock-steady. He'll be dead in 60 seconds if I don't, she stated, her voice flat and cold. And his death will be on you, doctor. She plunged the needle into the soldier's chest. There was a sickening hiss, like air escaping a punctured tire. The soldier's body relaxed. The monitor behind him, which had been screaming a chaotic alarm, settled into a steady, rhythmic beep. His oxygen saturation numbers began to climb. Clara had just saved his life. She worked with a speed and confidence that was mesmerizing. I need a chest tube kit, 36 French. Someone get me a level 1 infuser and hang 4 units of PRBCs and 4 of FFP. I want a 1-to-1-to-1 resuscitation protocol. Jessica! She barked, and the young resident jumped as if she'd been tased. Stop standing there and get me a portable ultrasound. I need to do a fast exam to check for internal bleeding. Move! Jessica, her face pale with a mixture of fear and awe, scrambled to obey. The entire ER staff, who moments before had pitied or scorned this quiet old nurse, now moved to her command without hesitation. She was the center of gravity, the calm eye in the storm, and they were all just planets caught in her orbit. Dr. Hayes stood uselessly to the side, his face a mottled canvas of fury and humiliation. He had lost control of his own ER to a nurse he'd called a maid. Just as Clara was inserting the chest tube with a practiced, steady hand, more men in uniform arrived. At their lead was a man with the eagles of a captain on his collar. He was weathered, hard, his eyes carrying the weight of command. He surveyed the scene, his gaze sweeping past the cowering Dr. Hayes and landing on Clara. His stern expression melted away, replaced by one of stunned, profound respect. He walked directly to her, ignoring everyone else. He stopped a few feet away, waiting patiently until she had secured the tube and glanced up. Their eyes met. He drew himself to attention and rendered a salute so sharp it could have cut glass. Commander, he said, his voice thick with emotion, I'll be damned. We heard you'd retired. Clara gave a small, weary nod, her hands still covered in the soldier's blood. Someone has to look after the boys when they come home, Captain Miller. Captain Miller held his salute for a moment longer before turning to the hospital administrator, who had scurried down from his office. His eyes were chips of ice. Do you have any idea who this woman is? He asked, his voice dangerously low. The administrator shook his head, looking dumbly from the captain to Clara. Miller's gaze flickered to the name tag pinned to Clara's scrubs. Clara, he read with disdain. We knew her as Commander Clara Reed, but to the men in SEAL Teams 2, 4, and 6, she was known by another name, Angel 6. He took a step closer to the administrator and Dr. Hayes, his voice dropping to a near whisper that was more menacing than any shout. This woman is a legend. She's a recipient of the Navy Cross for her actions during Operation Medusa's Gaze, where she held off an enemy assault on a downed helicopter and saved the lives of 7 men, all while being wounded herself. She has a Silver Star for running through a minefield under fire to reach a wounded Marine. The shrapnel from that day is still in her leg, which is why she has that limp you've probably all made fun of. Every eye in the room was now on Clara's leg, the source of her supposed clumsiness. The captain wasn't finished. He pointed a rigid finger at Dr. Hayes. She has more real-world trauma experience in one of her fingers than you have in your entire coddled body. She has performed surgery in the back of a bouncing Humvee with nothing but a headlamp and a prayer. The man on that table, Master Sergeant Trident Wallace is alive right now for one reason only, because his angel of mercy was here to pull him back from the gates of hell. He turned back to Clara, his expression softening again. The tremor, Commander. Is it still bad? Clara looked down at her hands. For the first time all night, they were perfectly still. Not tonight, Captain, she said softly. Tonight, they were quiet. Dr. Preston Hayes stood frozen, his face ashen. His reputation, his authority, his very identity had been dismantled in front of his entire staff in less than 5 minutes. The snickering residents, Jessica included, couldn't meet his eyes or Clara's. They stared at the floor, the full weight of their shameful behavior crashing down on them. The story of what happened in Trauma Bay 4 that night spread through St. Jude's like wildfire. Dr. Hayes was suspended pending an investigation, a move everyone knew was a prelude to his termination. Clara Reed, the quiet, invisible nurse, became a living legend. She said nothing about it, simply showing up for her next shift and doing her job. But something had changed. The way people looked at her was different. They saw not an old woman, but a warrior. The whispers that followed her now were not of mockery, but of awe. When she walked through the halls, her quiet limp no longer a sign of weakness but a badge of honor, staff members would straighten up, their posture unconsciously mirroring the respect she commanded. A week later, Master Sergeant Wallace was stable in the ICU. Clara was checking his chart when Captain Miller and 2 other SEALs from his team entered the room. They stood silently until she was finished. As she turned to leave, all 3 men snapped to attention. "Commander," Miller said simply. Clara paused, a small, genuine smile gracing her lips for the first time in years. She looked at the men she considered her boys, saw the profound gratitude in their eyes, and felt a sense of peace she thought she had lost forever in the dust of Afghanistan. She simply nodded. "Carry on, gentlemen." And she walked away, her back straight, her hands steady, her presence no longer a whisper, but a quiet, thundering roar.